We are happy to welcome you here in Moscow, and we gathered in the year of the 17th year of the Universal Human Rights Declaration, and we are united by the idea of preservation of the right of humans for life and medical assistance. And the right for life is stipulated in one of the most important international documents, the Sustainable Development Goal of UN number 17. But today, the world is experiencing challenging time. The fundamental rights of humans for life and health are subject to unprecedented danger. In this connection, our mission as ombudspersons is to do everything possible to protect these rights in close interaction with government agencies and institutions of the civil society. So may I introduce the attendees and members of our today's assembly. Today, we have the President of the General Inspection Organization of the Islamic Republic of Iran, Justice Hudayan. Akikachi of the Kyrgyz Republic, Ms. Jamila Jamanbayeva. The Commissioner for Human Rights in the Republic of Kazakhstan, Mr. Lastayev. Commissioner for Human Rights in the Republic of Tajikistan, Mr. Bobozada. Commissioner of the Oli Majlis of the Republic of Uzbekistan for Human Rights, Ms. Esmatova. The Commissioner of the Human Rights Commission of Mongolia, Ms. Sangisharov Dondov. Protector of Citizens in the Republic of Serbia, Mr. Zoran Pasalic. And truly, yes, High Commissioner for Human Rights in the Russian Federation, Tatiana Moskalkova. And also, as attendees, we have the candidates for the permanent member of Eurasian Ombudsman Alliance, the chairperson of the National Institute for Human Rights of the Kingdom of Bahrain, Mr. Alderazi. And as observers, we have attendees that include Commissioner for Human Rights of the Republic of Azerbaijan, Ms. Aliyeva, the Ombudsman of the Republic of Turkey, Ms. Turchak, the Chairman of the Standing Commission of the House of Representatives of Human Rights, National Relations and Mass Media of the House of Representatives of the National Assembly of the Republic of Belarus, Mr. Davidko, and the Chairman of the Standing Commission of the House of Representatives on Human Rights from the National Assembly of the Republic of Belarus, Ms. Makarina Kebak, and the authorized representative of human rights in Turkmenistan, Ombudsman, Ms. Gurbanazarova. And also I would like to welcome our guests, Commissioners on Human Rights from the constituents of the Russian Federation, and authorized representatives in the Republic's Commissioner for Human Rights in the Republic of Abkhazia, Ms. Kishmaria, Ombudsman of the Republic of Burundi, Ms. Kanyana, Ombudsman of the Republic of Mali, Ms. Malle, the Commissioner for Human Rights in the Republic of Nicaragua, Ms. Munguia, and also the Ambassador of the Republic of Nicaragua in the Russian Federation, Ms. Mejia, and the Commissioner of Human Rights and Good Governance of the United Republic of Tanzania, Mr. Shuli, the Chairperson of the Uganda Human Rights Commissioner, Ms. Vangaja, the Chairperson of the Human Rights Commission of Sri Lanka, Mr. Dehidenia, and the Commissioner on the Human Rights and the President of the Republic of South Ossetia, Mr. Tassoev. So, dear colleagues, we have here representatives of government agencies of the Russian federations that include Deputy Chairperson of the Federation Council of the Federal Assembly of the Russian Federation, Ms. Svetenka, Chairperson of the State Duma Committee for the Development of Civil Society, Public and Religious Associations Issues, Ms. Olga Timofeeva, the Chairperson of the State Duma Committee on Health Protection, Mr. Bashankaev, the State Secretary, Deputy Minister of Health of the Russian Federation, Mr. Oleg Salagay, the Head of the Department of International Cooperation on Human Rights of the Ministry of Foreign Affairs of the Russian Federation, Mr. Grigory Lukyantsov. Dear colleagues, we also have here present the Commissioners for Human Rights in Altai region, Mr. Anton Vasilyev, Commissioner for Human Rights in the city of Moscow, Ms. Tatiana Potaeva, for Primorsky region, Mr. Yuri Melnikov, for Yaroslavl region, Mr. Sergei Baburkin. Dear colleagues, let's greet everyone. Dear colleagues, you have elected me as the chairperson of the Eurasian Ombudsman Alliance till 2024. So allow me to begin exercising my duties as a moderator, and let's declare our Assembly of the Eurasian Ombudsman Alliance open. At first, we need to approve our agenda. It was sent beforehand to every member of the Alliance. Do we have any proposals on changing the agenda? No. So then let's consider the agenda approved and let's begin our work. Item number 1 on our agenda, on the new member of the Eurasian Ombudsman Alliance. Dear members of the Alliance, 1 year ago, in advance, regarding the application which was submitted by our colleague, the chairperson of the National Institution for Human Rights of the Kingdom of Bahrain, Mr. Alderazi. So together with the applications, all due materials were submitted to us, and your opinion on their accession to the Eurasian Ombudsman Alliance was positive. However, you wished to meet Mr. Alderazi in person and give him the opportunity to present in person and tell us about the Institution for Human Rights and the work Mr. Alderazi is carrying out. So, Mr. Ali Ahmed Alderazi, would like to give you the floor. Over to you, please.
And I would like, first of all, to extend my sincere thanks to you for accepting Bahrain National Institute for Human Rights request to join the Eurasian Alliance for Ombudsmen, which is a platform for ensuring the development and the strengthening of cooperation between the ombudsmen and national human rights institutions. It is my pleasure to participate with you today in this meeting to present our experience and benefits from your extensive experience in the field of human rights, to exchange best practice and listen to the experience of other institutions and bodies working on this regard. The joining of our institution to your esteemed coalition comes out as evidence of our sincere desire to strengthen cooperation with the international community to overcome difficulties and achieve more in the field of promoting and protecting human rights. In the conclusion, I reiterate my deep thanks and sincere appreciation to the Alliance and to all the participants in this meeting, hoping that it will achieve its desired goals. Thank you very much.
Many thanks, Mr. Al-Dirazi, for very informative presentation of your institution. Dear colleagues, do you have any questions to the candidate for membership in the Eurasian Alliance of Ombudsmen? If you have any comments or remarks. So with your permission, I would like to say a couple of words. I met Mr. Al-Dirazi as the chairman of the National Institution of Human Rights Protection of the Kingdom of Bahrain, and we signed an agreement, and I could visit the Kingdom of Bahrain twice, and we discussed the most important and relevant issues related to the agenda of human rights protection, and I saw how efficient was the work of the institution of human rights, of the National Institute for Human Rights, and I witnessed the large amount of work carried out to support and protect human rights. Recently, I visited Bahrain, and I saw how interesting the public was in the experience accumulated by the National Institute for Human Rights of the Kingdom of Bahrain, and I am happy that all the members of the Eurasian Ombudsman Alliance supported the accession of Mr. Ahmed Al-Dirazi as the chairman of the National Institute for the Human Rights of the Kingdom of Bahrain to our friendly team. And I think that we are all happy and would like to express our hospitality and greet you on the occasion of becoming a new member of the Eurasian Ombudsman Alliance. Dear colleagues, as you have already expressed your agreement, I decided to skip and don't put this issue on agenda for voting because you all support it. So let's now proceed to item 2 of our agenda. It was not occasionally that we selected the topic of protection of the human right for health care and medical assistance. We have discussed this topic a number of times, and we decided to choose this topic because the most relevant for every person is the right for health care, for the protection of life and health care. And there is a set of documents adopted that ensure protection of human life for the society, for the state, and that's why we decided to highlight this topic as the most important for the Eurasian Ombudsman Alliance's agenda. We all have developments and have accumulated fundamental experience. So today we can share our best practices accumulated in the area, and I hope that our assembly would allow us to get to a new level in the area of human rights protection in the field of healthcare and medical assistance. So, dear colleagues, on behalf of the Council of the Federation, we have the Deputy Chairperson. So, dear colleagues, on behalf of the State Duma of the Russian Federation, we have here the Chairperson of the State Duma's Committee on Human Rights Protection, Mr. Badma Bashankayev.
Tatiana Nikolaevna, colleagues, dear friends, guests of our great country of Russia, locals, today is a great event, a beautiful event here. In all religions, they teach to love one each other, to protect your neighbor. But when there is an official body that performs this function, this function is done by you. This is a sacred task. If sometimes in this activity you have some doubts, or you think that you may be tired, or there is some misunderstanding there, let me, on behalf of the State Duma, on behalf of all the doctors who work here, you're doing a great job, and never give it up. If you think results are not appreciated, don't believe it. They're important. People appreciate it. It's a sacred task to do. And we will be discussing healthcare. It's a very important topic for the State Duma. Thank you for doing your job. And I had to come here today, so thank you sincerely from the bottom of my heart for your work, and we will keep supporting you. And have a great conference today. Thank you so much, Bogdan Nikolaevich. Multiple times we contacted the State Duma with various initiatives on legal initiatives to help specific people who were in a difficult situation, and we always got their support and help. So many thanks to the chairperson of the State Duma, Mr. Volodin, for unprecedented and deep and active support of the institution of Human Rights Commissioner. Dear colleagues, in front of us we will have a video. The Minister of Health of the Russian Federation, Mikhail Murashko. Dear colleagues, greetings to all the participants of the 8th session of Eurasian Ombudsman Alliance. Today's topic is human rights in healthcare and medicine. It's an important topic. So this is one of the integral parts of human rights. It's part of the Constitution. And we have adopted multiple documents that define the development of the sphere in long term. These documents clearly formulate key trends in prophylactics, patient orientation, and more broadly, how we can be human-centered and how we should create necessary conditions to digitally transform healthcare. Our ministry creates all necessary conditions to implement this government policy and make sure a legal framework is in place and that human rights can be fully exercised by every citizen of our country. It's a three-level system of providing medical care. It is still being implemented. It starts with perinatal care and all the way up. It meets all the requirements of patients and brings the actual doctors closer geographically to where people live, and also for the do prophylactics prevention. And also we develop competency centers. Medical organizations implement medical aids there based on clinical recommendations and also create conditions that ensure the that medical care meets established requirements. We developed over 400 clinical recommendations, including nosologists, 84 for oncological diseases and 32 for cardiovascular diseases. Of course, they cover not only those, it's broader, but this is the way it was worded initially. And of course, this system needs to have some material base. We are in the third stage. It's based on the previous two projects that were complete modernization of the healthcare system back in 2011 and large-scale construction of perinatal centers that reduced infant deaths rates and maternity deaths and took them to the lowest levels ever in our history. And now we work on developing our regions. We have federal projects to work with family doctors and provide upgrade and modernization. We build large clinics, competence centers, and it's unprecedented. It all creates a basis to a transition to a new level in healthcare, comprehensively in line with digitalization. Also, the current approach is project-based. We invest into infrastructure of healthcare. We upgrade it. We also upgrade the actual process of providing Medicare. We use back-to-back technologies. During the pandemic, national project added some initiatives of socioeconomic development that contained target measures to develop healthcare systems such as medical Internet of Things or personal helpers, making healthcare closer to patients, developing digital services, My Healthcare, which are available via portal of government services. The idea being to use practical-oriented approach for this industry, and the focus in scientific research is on in oncology, cardiovascular disease, and orphan diseases, and also developing new platforms for vaccines. Medical science platform should reduce time to market for drugs, for various types of drugs, including neurocognitive technologies and using AI technologies, etc. Today, genome data, generative medicine, computer interfaces, and rehabilitation, they become practical tools in our healthcare. We pay a lot of attention in improving accessibility of medical help aid. We run our infrastructural projects, and we gain some positive experience how we can improve coverage in terms of first aid, building fast-to-build structures, ambulances, using mobile medical complexes that help to cover with prevention and diagnostic services. Many people who live in remote areas, we also actively develop and use technologies of first aid and medical evacuation, uses sanitary aviation, etc. And of course, all of that is covered by digital technologies. The Constitution of the Russian Federation guarantees free medical services from government and municipal organizations. So making sure that we have a universal coverage, it's all based on medical insurance and solidarity principles, social equality. And it's realized thanks to the mechanism that takes into consideration real needs of populations. I would like to separately note that accessibility is improved, including high-tech medical services. and we have a greater number of patients that receive that high-tech those high-tech medical services. It's one of the priorities in our healthcare system to increase those volumes. In 2023, the number of patients who receive those high-tech services grew by 12% and to over 1.2 million. And the number of patients who live in rural areas who received high-tech medical services, their number increased by 40,000. And this is one of the priorities, to make sure that those services are equally accessible. And it's not a static thing. The list of services included is expanding. So speaking of government guarantees, in 2024, we allocate over 3 trillion rubles towards these goals to make sure those services are better accessible. Also, we focus on rehabilitation and prevention. From year to year, those services become more and more accessible to citizens. We have remote education, remote services, and these trends, of course, become part of the of healthcare. To make them truly accessible, we build centers for interaction with patients. It's one of the key areas of developing healthcare: proactive monitoring of health state, personified profiles, screenings, and many other things that help basically shape needs of a specific person. Also involving internet resources, personal profiles for communications with citizens, including electronic document turnover or electronic document management systems. So one of the areas where medical data is used is so once data is received, it can be used in multiple areas. And going forward, telemedicine can be used wider. Our doctors already work in this area. So we also, not only doctor to patient, but patient to doctor direction should be developed. It's a little bit more complicated, but it's very promising. Speaking of centralized clinical services based on clinical recommendations for diagnostics, reducing time required thanks to optimizing the various functions. All of that is guided by artificial intelligence. Digital profiles of a patient, of a medical organization, of a doctor, they basically provide lots of prerequisites for that. For example, today you get your medical insurance policy digitally using a government services portal. You can be using plastic card or a paper document are not needed anymore. You can show that electronic document on your smartphone. You have sign up for a doctor visit online, and data is provided automatically from your profile, and many other things are become true. So using this portal, patients already made over 5 million sign-ups for doctor visits. That really facilitates communications with medical organizations. And of course, when people are attached to a specific clinic, it's also a service available online. So we would like to switch to a proactive model and do more prevention. Similarly, we create a digital twin of a doctor. So we have a registry of medical professionals. So it's a consolidated database, and also consolidated database of those who are still being trained to become physicians. So we have a federal registry of medical organizations. So it's part of the license. We have compiled databases, compiled information on them. So in the final analysis, all of that helps to manage quality of medical procedures, medical services, plan procedures depending on the needs, also take into consideration geographical specifics. So healthcare indicators can be managed proactively when we develop digital twins of processes. This is machine reading rules such as clinical recommendations, processes of providing medical care, so digitalization of signing up for a visit. This is the most required procedure. It sounds like a very simple one, but actually it's a good indicator of digital maturity of medical organizations, because infrastructure should be in place, medical and business professionals and should be at the right level, and also it's the system should handle that volume. So because sometimes we have up to 60 million applications, so information infrastructure had to be reworked. It should be a single environment where data is entered once and can be accessed at different level. So when people pay or when they evaluate its functioning. Also, it's a mutual integration of all digital resources in healthcare. They should be part of the same system at different levels, locally, regionally, and at the federal level. Registry of patients, digital medical profiles, digital twins of medical professionals and medical organizations. All of that takes us to the third stage, which is the data compatibility, single environment, digital environment. It can be done only when universal reference books or references are created for information systems. That should help create a single digital environment, unified digital environment. Basically, it is the next stage in development of all the healthcare system. What has been done so far in all the subjects of the Federation, we have medical information system that significantly simplify and facilitate routine processes. We go from informatization to automation using AI technologies, among other things. In Russia, has 28 such solutions with AI components, but also implemented and over. It's been implemented in 72 subjects, and more are coming online. So signing for a visit is one of the most used service. To conclude with this topic, digital technologies is an aid. They provide help, but they do not replace the actual service. They just help reduce routine work, reduce the number of administrative personnel, and help forecast risks for the patients before actual diseases develop. Basically, it simplifies the work of the system in terms of getting a specific paper, a certificate, because it normally takes time and they become more available. We have resources to reduce mortality for each age group, to protect health. And for that reason, we form prevention programs for diseases, for inabilities to protect health, correcting factors that lead to chronic disease, prevention of cardiovascular problems, also improving health in people with advanced age, use high-tech medical services, and also compensation of infection disease for longevity. We understand that for all ages we need to approach differently, and it's based on the paradigm of increasing prevention and focus on specific diseases that contribute the most to mortality. So this should be the vector going forward in our actions. medical healthcare in Russia, thanks to investments from the government into medical infrastructure, technologies, processes, and sciences, it becomes interesting for foreign citizens. It becomes more attractive and more competitive in terms of prices and in terms of quality. And there is a proof of that that comes from stats. In 2023, our country was visited by 14 million foreign citizens for healthcare reasons, which is larger more than in the previous year. So over 14 million people together visited the Russian Federation from 2019. Russia is open to those interactions. We can do medical science, we can export products, we can export information systems, provide healthcare to citizens of other countries. So, dear friends, healthcare system is being developed, and now we are at a historic moment when many processes will become the basis of the future healthcare system. Thank you for your attention.
Mr. Mikhail Murashko, well, actually, he didn't only greet us, but also presented a detailed speech on how the healthcare system of the Russian Federation is developing, on what new institutions are emerging. And it is really important that the Ministry of Healthcare is instantaneous in its response to all addresses to the institution of the human rights. We also have here the chairperson of the Deputy Minister of the Healthcare in the Russian Federation, Mr. Oleg Salagai. So, Mr. Salagai, could you please express our gratitude and pass our regards and words of gratitude to the minister? We are really grateful for your assistance to people who find themselves in a challenging situation. They mainly include people from the risk categories, senior people, disabled people, people with a disability, people who suffer from mental diseases, people who suffer from orphan rare diseases that require investment. And we always get support from the Ministry of Healthcare when we address them with systemic issues. Now, I would like to give the floor to the chairperson of the State Duma Committee on the Development of Civil Society, Issues of Public and Religious Associations, Ms. Olga Timofeeva, one of our biggest friends in the State Duma of the Russian Federation, and together we advocate projects on promoting human rights. So thanks a lot, Ms. Olga Timofeeva. Over to you. Dear Tatiana Nikolaevna, dear human rights activists, dear colleagues, we are not doctors, every one of us, but we are all patients, and we understand how essential the topic of human rights protection in healthcare is for us. And recently, the relevance of our work is really growing. I would like to recall the days when the Eurasian Ombudsman Alliance was created. So now we feel much stronger, and I'm really happy that we get representatives from other countries proactively involved. Belarus, Azerbaijan, Iran, other countries, and I have the representative of Nicaragua sitting in front of me. And our delegation of the State Duma, together with our spokesman, visited your country twice earlier this year. And we had a number of challenges like pandemics all the world experienced. No one could have told us they were prepared. The world is not stable today, and we have different sources of tension, political and others, and our health suffers from it. And we have ombudspersons acting in different regions of the world. We have instability in the Caucasus, in the Middle East. That means thousands of victims, thousands of wounded that need help. So today we talk about human rights defense and the importance of healthcare. Let's recall the major earthquakes in Syria and Turkey in February earlier this year, Afghanistan, the 7th of October, the flooding in Libya. And these are challenges our doctors and healthcare professionals face today. They are dreadful, reflected in the lives and health of people. A number of issues we come across after the onset of the COVID-19 infection, how quickly it can spread, and if we are ready to respond and influence quickly to tackle all the challenges. We have efficient diagnostics methods. Our researchers invent vaccines and medicines. But in an emergency situation, we have a rise in requests and applications. We are all patients, and we understand, like no one else, that it's essential for us to stay alive and healthy. The right for healthcare protection is number one. Everyone would like to be safe and sound and have the right to apply for healthcare assistance. When the pandemic was on its peak, we had a big number of requests, and many of you had to restructure the work of your ombudsman's offices. And in our regions, there was, well, regional ombudspersons were practically involved in these type of work in the regions. And we have new areas like assistance to refugees, to wounded children and women, rehabilitation of military men. And this is a major challenge to us on how we can accelerate, how we can offer our assistance faster, because human lives and health depend on it. There were important decisions made by the State Duma in the area of telemedicine, when you can use the internet and the computer to offer medical assistance faster, when you can sell drugs and medicines online, when it's not possible for you to visit a pharmacy physically, when you can get medicines on prescriptions delivered online. And for the pharmaceutical market, it's essential to realize that we have all drugs available in the market. In our country, when the special military operations, many pharmaceuticals left the market, and we have the import substitution. But at that moment of time, there was a great shortage of drugs you couldn't find in the pharmacies. And it's a humanitarian mission. It's impossible to play with the health of the people. And yesterday in the State Duma, we discussed the comprehensive rehabilitation of people, because they are really deprived people. We need to look at if they have prosthetic means available, if they have everything they need for the comprehensive rehabilitation. And we know that today Ms. Tatiana Moskalkova, as the Ombudsman of the Russian Federation, prepared a very important speech, and we would like her to present it in the State Duma on the protection of mentally challenged people's rights. Well, when people with mental disorders can take weapons in their hands, and it's an important topic. We should all focus on the way out. And there was a draft project on the ban of selling vape systems to minors. It is about a modern type of an electronic cigarette, and a big lobby behind it. But we reviewed the international law, and 32 countries in the world made vapes equal to illegal drugs. And we can watch our children smoking the vapes despite all sorts of bans, and they get addicted to it very quickly. The parents of children keep buying electronic cigarettes for them, and there are questions people ask to us as legislators, but 32 countries in the world see a great threat in it, and they put a ban on vapes, and it's essential for us as well. And if you, Ms. Tatiana Moskalkova, will plant these questions today and focus on how we can protect our children from the problem we face today. And dear colleagues, in my conclusion, I would like to say we are not doctors, but we are all patients, and we all understand that we should do everything possible for us to protect and extend lives of our children, of residents of our countries. It's really important, and we need to find the common points for contacts as legislators and as community institutions, and we look forward to exchange of feedback and your recommendations on how you manage to solve these problems in your countries. And I would like to repeat once again, in our country, our attitude to doctors and healthcare system changed during the years of the pandemics. A doctor became your biggest friend, a person you would call to ask for advice. And it caused a change in the system. But I would like to encourage you to really pay attention to the healthcare system, because human lives depend on the work of the doctor. We are all deputies, and we have Senator Ms. Inna Svitenko present here, and we all work to protect human lives and health. Let's find all possible tools and mechanisms for us all to live in a healthy world. So thanks a lot for coming here to our country, to our great Russia. And here you should expect a friendly welcome, our hospitality, and we would like to act as a catalyst to resolve all possible issues on the agenda. Thanks, Ms. Olga Timofeeva, for your detailed presentation. It wasn't just a welcoming address, but rather a vision of the State Duma on the development of the healthcare system and the role and mission of the Ombudsman in this work. Now, I would like to give the word to the Deputy Chairperson of the Federation Council of the Federal Assembly of the Russian Federation, Ms. Inna Yurievna Svitenko. Over to you, and thanks a lot for finding time, being so busy, to come here and greet the members and observers of the Eurasian Ombudsman Alliance. Dear Tatiana Nikolaevna, dear colleagues, first of all, let me welcome on behalf of the chairperson of the Federation Council, Ms. Valentina Matvienko, all the members and guests of this assembly, the eighth Assembly of the Eurasian Ombudsman Alliance. We are discussing the human rights protection in the area of healthcare and medical assistance. The Council of the Federation really focuses on improving and observing the legislation of human rights protection in this area, and we cooperate with the professional community. In recent years, the government of the Russian Federation made a lot of decisions in this area to provide free medicines and drugs to residents, improving the system of obligatory healthcare insurance. And in Russia, there are federal laws that protect the human rights in the area of healthcare. And it's important that providing medicines and drugs to the residents of the Russian Federation covers is covered by 70% of Russian-made products, because despite unprecedented sanctions from the Western countries, our citizens are provided with drugs, and the constitutional rights for the healthcare protection and medical assistance are ensured. The Russian Federation is the only country where the medical assistance to children who suffer from orphan diseases are provided. So such medications are really expensive, but we made the decisions to establish a fund from the tax on the rich. And as for today, 23,000 children are registered with the Circle of Good Foundation that provides medications to the children who suffer from rare diseases. And let's also focus on the problems we can resolve together: scientific and technical progress, the technological breakthrough. The use of the telemedicine allows us to bring medicine to a personified level. It is related to the threat of disclosing personal data. Citizens must be sure that their personal data will only be used for healthcare protection. And we are sure that if we unite our efforts, it will allow to improve access to the state-of-the-art solution in medical health care for the residents of Russia and your respective countries. And in my conclusion, I would like to express my gratitude to Tatiana Nikolaevna personally and all the members of the Alliance in the work of this highly important organization. And I'm sure that this breakthrough in health care, the technologies which are being used, the banks of biomaterials being used, that they constitute the area that couldn't be ignored by ombudspersons to ensure that every person has the guarantee for healthcare protection and protection of personal data. Thank you. Many thanks, Inna Yurievna, for your kind words and wishes, for your welcoming words. And we would like you, as the Deputy Chairperson of the Federation Council, all the best. And please pass our warmest regards to Valentina Ivanovna Matvienko for supporting the activities of the institution of Ombudsman in the Russian Federation. Now, I would like to give the floor to the Director of the Department for Multilateral Cooperation on Human Rights of the Russian Ministry of Foreign Affairs, Mr. Grigory Lukyantsev. Over to you, Grigory. Many thanks, dear Tatiana Nikolaevna, dear members and participants of the Assembly, dear colleagues. I would like to warmly welcome all the participants of our 8th Assembly of the Eurasian Ombudsman Alliance on behalf of the Ministry of Foreign Affairs of the Russian Federation, and I would like to express my sincere gratitude to Ms. Tatiana Moskalkova personally for her initiative of establishment the Eurasian Ombudsman Alliance and her role in its establishments and activities which stemmed from her personal efforts, her resolution and focus. Without her, it would have been impossible. And we are attending the 8th Assembly of the Eurasian Ombudsman Alliance already, and the structure has proved its role as a forum for harmonizing a fruitful dialogue for the sake of ensuring human rights in all member countries of the alliance.
No. In these difficult times, these national systems of human rights protection are a safe guarantee to protect human rights, not only at the national level but also at international level, because it's no secret for anybody that in today's status of intergovernment interaction in human rights sphere goes through difficult times. There are many challenges. Oftentimes, human rights are used as a pretext for intervention, to push their values as being supposedly universal values, even for distorting the essence of human rights as they were first formulated in the initial international documents that set human rights and freedoms out. And in this relation, today, as never before, it's important to encourage dialogue between ombudsmen. It leads to further strengthening of national institutions of human rights as well as mechanism of international human rights interaction and cooperation. It's very symbolic that today's 8th session of the Eurasian Ombudsman Alliance takes place in a year which is of significance. This year we celebrate 75 years of Universal Human Rights Declaration and 30 years of the Vienna Declaration and Action Program of the Global Conference of 1993. Adoption of the declaration back in 1947 was a result of the World War II. It was a response of the global community to the horrors that were brought about by a Nazi ideology of the fascism, of militarism, that took away dozens of human lives, dozens of millions of human lives, and it took so many victims to prove that the ideas of racial superiority of Nazism should not be there in the civilized society. UN members, when adopting the Universal Human Rights Declaration, were moved by the desire to erect the value of human life, and it helped shape the modern system of modern regime of human rights. And this declaration has a direct relevance for today's meeting. And if we look to Article 25 5 of the Universal Human Rights Declaration that states specifically in detail what criteria are for health protection, all the key elements of this right. And today, when we hear different voices saying that Universal Human Rights Declaration is an obsolete document, and this document sometimes it's called detrimental or harmful, that it should be reworked drastically, we should get rid of it even, but that tells us still that it's not enough to analyze it. We should go back and look at its text. If we do it and we carefully read it, then we can see that this document is aimed at bringing closer states, governments. There are no elements about bringing states apart. It's for cooperation. And key problems, as we perceive them in today's international cooperation in human rights sphere, are related not to the Universal Human Rights Declaration. They're related to the way how specific governments pursue their specific interests, how they reinterpret this document. So in this year of the 75th anniversary of Universal Human Rights Declaration, it's important to reaffirm its significance and to state once again that our states are faithful to the spirit and the letter of this declaration. Tatiana Nikolaevna, I would like to thank you once again for this invitation to participate in the opening session of the Eurasian Ombudsman Alliance. Once again, to congratulate you with the successful development of the Eurasian Ombudsman Alliance and wish all the participants of today's session success and fruitful discussions. Thank you. Thank you so much, Grigory Evgenievich. You discussed international relations and the global situations, and it's important that together with the Ministry of Foreign Affairs, we've been through trials related to these 2 years of COVID, when we evacuated our fellow citizens from other countries, when we organized help to foreign citizens in our territory, among other things. It's important that today, under the conditions of Arab-Israeli conflict, many is being done for our citizens to be timely evacuated from dangerous hazard areas, that they receive all the necessary help, including medical help. Dear colleagues, I would like, on behalf of all of us, to thank representatives of the government authorities who came here to welcome us. The opening of our meeting of this Eurasian Ombudsman Alliance. And now we move to the second item on our agenda. And I would propose to those who are speakers to follow the 10-minute limit for members and 7 minutes for observers. And being the chair and the host, I would like to be the first to speak with my presentation. Those who welcomed us, the Minister of Health and Deputy Chair of the Federation Council, they provided such detailed presentation that it really facilitates my task of familiarizing you with the general situation, how care is developing in our country, and how this system of guarantees is developed for health protection and medical services. Dear members of the Eurasian Ombudsman Alliance, observers, colleagues, life and health are integral values of human life. It's spelled out so in our constitution and federal law on health protection and in other domestic laws and pieces of legislation. It is important that this system of legal framework is constantly develops. The Constitution has expanded guarantees of health protection. It sets out norms. According to them, the state has to provide access to health care, and its quality creates conditions for healthy lifestyle. Healthcare guarantees in Russia are being done and developed and expanded on a permanent basis. It is very important that today, as stated earlier by the Minister of Healthcare, we run national projects in healthcare, and includes some of our proposals from Ombudsman, from regional Ombudsman, and myself as a High Commissioner for Human Rights in Russia. The project will be run until 2024. And at the same time, we talk mostly about achievements that we have had that we have had in the Russian Federation. At the same time, we analyze incoming complaints and messages, and we can conclude that health protection is of great relevance for our state and also for many other states of the world. With government authorities, institution of Higher Commission for Human Rights is involved in activities in health protection. It is done in 5 main areas. They're listed here on the slide, so they're clearly described here. The first one and the main one is handling complaints to see if there are any violations and to take measures to make sure those rights are restored. Annually, I receive about 2,000 applications or messages. For the most part, they come from elderly people, from persons with disabilities. A lot of them come from this year on medical health, from people who have been evacuated from Donbass and from the Ukraine. Over 5 million of those people came to our territory, and those who were in temporary locations to make sure they have free residence, free clothes, free food, and free medical care. We responded to many, many letters and messages of people who came to us looking for protection from bombing and from shelling on the part of the Nazis. And with our healthcare authorities, we provided help, provided surgeries, establishing disabilities, providing drugs, medical drugs, especially for those whose life depended on those drugs, like for diabetes patients. So the breakdown of those applications is provided here. You see, we can see that we have fewer complaints in this category. We think it's a result of effective government policy that was presented earlier today by our authorities, from legislative authorities, from executive authorities, from our Ministry of Foreign Affairs. Based on the results of those applications, only this year we restored rights for healthcare for about 800 people. So their disability classifications were reviewed and changed. So rehabilitation means were provided for persons with disabilities. Medical drugs were provided to people who suffered orphan diseases. One of the new tools when we work with those complaints is administrative cases that could be opened against. So people don't have to initiate a law case. So there was a person who was imprisoned as a suspect, and he complained that medical services were not provided to him while he was in jail. When he considered himself to have coronavirus symptoms, and we followed up on this complaint, and his facts and the facts that he cited were confirmed. So those authorities were not taking action, which was not illegal, and they actually were sanctioned for it, and the person received necessary medical services. Second area is developing recommendations and proposals for government institutions on improving legal framework and its implementation. We work closely with the Federation Council, with the State Duma on these issues, and we summarize and generalize complaints coming from citizens with regard to healthcare and providing medical services, and formulate our proposals in our annual report of the Commissioner for Human Rights. And we also have specialized reports. On this slide, you can see those reports. Those reports on human rights protection during the pandemic of COVID-19 for disabled persons and for people with mental disorders, and also people rights for social services. So many initiatives that were spelled out in these reports based on the analyzing people complaints. So they're being implemented and they're part of our practices. So the government heeded our proposals on how healthcare should be provided to disabled children. And so, for instance, when they travel by air to the location where healthcare is provided, it's very important for disabled children. We also new rules were developed for penitentiaries, for correctional institutions, and also for jails. So prisoners have better rights for health care as a result. Together with government authorities, we were able to achieve hospitalization of prisoners to civil medical institutions if there are no conditions for such services, like if they need a surgery or they need qualified medical services in a stationary institution. As a result of those measures taken, the number of complaints is going down. When we talk about penitentiary system, complaints on the quality of medical services. So we are very thankful to the Ministry of Justice and Federal Penitentiary Service for responding to our applications and doing a good job and improving rights of suspects and prisoners and convicts, those who are in detention centers and institutions. With the Ministry of Health of the Russian Federation, we developed proposals to improve accessibility of drugs for people with rare orphan diseases. As it is known, those are very expensive drugs, and not every person can afford buying such a drug. So we ask our healthcare system to expand the list of those diseases for medical coverage, state coverage. So the list has been expanded, the number of positions for rare disease, so from 7 to 14. So now they have right to get it free of charge at the expense of the state. Also, rural doctor program has been expanded with our initiative. Medical professionals have a right to get a free ride, not only to the location where they get their training, but when they come back, it's also their travel is free of charge. We are very thankful that our joint proposal, along with the deputies, to support children of doctors who died during the pandemic from COVID-19, and this year, the children of those of medical professionals who died, they can enter medical schools without entrance examinations. That should help preserve the traditions and dynasties of doctors, improve guarantees of rights of medical workers and their families.
The third area is educational, legal education in terms of residents' right for healthcare protection. And here we have a number of interesting and profound projects focused on senior and disabled people. We have the tools for healthcare protection and medical assistance. We help senior and disabled people to fill in documents for medical checkup boards, to register as disabled people and address courts for assistance. We have legal marathon for retired persons. We deliver together with our colleagues in the constituents of the Russian federations. Also, the festival called Integration for Disabled People. And the fourth area for the Ombudsman is international cooperation and ensuring rights of Russian citizens staying abroad. So our bilateral cooperation can hardly be overestimated, as well as action being part of the scope of the Eurasian Ombudsman Alliance activities. We ensure the rights for healthcare protection for our compatriots staying abroad and also for foreigners who stay in the territory of the Russian Federation. For instance, in 2022, together with Ombudsman of Turkey and the Republic of Georgia, we reviewed a complaint of our citizen who experienced an accident in Turkey, and she lacked a medical insurance policy. And our interaction between Ombudsman helped her to come back to Russia via Georgia, and she got the medical assistance here in Russia. And I should remember how Miss Oliver helped us to open the border in the years of the pandemic, so that allowed citizens of Azerbaijan to get back home because the borders were closed. And this group included sick people and people who passed away and needed to be buried at home. And it was a brilliant example of interaction between ombudsmen that demonstrated how we should help people in all areas. So the fifth area is support of initiatives by government agencies in healthcare protection. And in some regions, we supported and even initiated a very interesting and exciting project on shaping health trains. Russia is a huge country, and it's difficult to cover all settlements with high-level, high-quality medical assistance. And in Belgorod and other regions, we started up health trains equipped with everything necessary for proper diagnostics. It allowed thousands of residents living in rural areas to get access to medical health care. We also have the campaign called United Against Diabetes. Together with the Fatherland Defenders Foundation, we offer assistance to participants of the special military operations who got wounded or if any damage to their health was inflicted. And our cooperation with the Fatherland Defenders Foundation has been fruitful, and I hope that today we can exchange our experience and formulate some proposals for further interactions between each other, and also we can develop some proposals for the government agencies aimed at improving the level of healthcare protection and medical assistance. And you can see another slide on the screen, and I would like to comment on it. Today, the Russian Federation and some other countries are subject to sanctions, and our residents report that a number of medicines and healthcare products disappear from our pharmacies, and they see it as a result of sanctions from the collective West. And I believe that drugs should never be listed on sanctions lists. Dear colleagues, thanks for your attention, and I would like to wish all attendees of our assembly health. This is my wish to you and your families. I would like to wish all the best and the good health to our members, participants, and guests. Thanks for finding time and opportunity to come to Russia to attend this discussion for the guarantees of the rights for healthcare protection and medical assistance. Thank you. Dear colleagues, now I would like to ask you to support my initiative to co-moderate today's meeting. And if you don't object, I would like to ask my colleague Akikachi, the Ombudsman of the Kyrgyz Republic, Ms. Jamila Jamanbaeva, to act as a co-moderator, as a chairperson. So could you please proceed with your speech and then help me to moderate this session? Good afternoon, dear colleagues, and I'm happy to welcome you to this assembly of the Eurasian Alliance of Ombudsmen. But before I begin, I would like to express my gratitude to Tatiana Nikolaevna for her contribution in the activities of the Alliance. And today we can state that the Eurasian Ombudsman Alliance is a valid, important forum for discussions in the area of human rights protections. And we as members can discuss relevant issues and find ways of their solutions. We realize that human rights are among the most important values in human life. And using this opportunity, I would like to congratulate Mr. Ali Ahmed Al-Dirazi, the chairman of the National Institute of Human Rights of the Kingdom of Bahrain, on the occasion of accession to the alliance. And I would like you to know that the Institute of Ombudsman Akikachi of the Kyrgyz Republic is always ready for cooperation in the area of human rights protection. And it's relevant to discuss the human rights in the area of healthcare protection and medical assistance. In 2021, the research in the Kyrgyz Republic focused on a survey that covered 3,000 respondents. 6.2% of residents didn't know if their rights were ensured, and 30.8% evaluated the protection of their human rights as negative, 36.6% as satisfactory, and 26% as positive. So our institution had to improve our activities, and we keep developing our recommendations reflected in the annual reports of the Ombudsman. So the institution of Ombudsman reviewed the effect of highly efficient pharmaceutical and palliative assistance. Also, in 2023, the institution of Ombudsman of the Kyrgyz Republic carried out an inspection of hemodialysis, and we developed a protocol on the hemodialysis procedure, and we investigated the legal barriers that hinder rendering these services. We are happy to share the results with our colleagues. Also, in the structure of the Ombudsman's office, we have the special service for support of people with mental disorders. We provide monitoring of patients on how they visit the mental hospitals and how conditions of their stay at the medical institutions are improved. The government of the Republic takes efforts, and we adopted the strategy on how we improve the well-being of all our citizens in the horizon till 2042. The Kyrgyz Republic keeps introducing digital technologies, and the health care system now has two systems: the electronic medical record book and the electronic system of data management. As for today, all employees of the National Hospital use these new tools. They initiated and registered over 13,000 electronic medical record books, and they keep storing the results of lab tests. One of the goals is improving the quality of data collections on the patients, and we keep storing online the electronic record books, which is a single contact point between patients, doctors, heads of laboratories, which saves time and reduces time required for paperwork. And this is also the way to store all patients' history electronically. If next time the patient is admitted to another hospital, it would be possible for the hospital employees to review the history, to check chronicle or allergic diseases. It's very convenient for diagnostics and treatment of diseases. Together and simultaneously with the use of this electronic medical record book, the electronic data processment system has been introduced. There is a personal barcode applied to the medical data history, which allows to have the representative data on laboratory tests data for all the patients. One of the advantages is the high speed of test results delivery, which directly influence the quality of treatment. In the Kyrgyz Republic, we have reportedly faced challenges with medicine delivery. Now, the single national system has been adopted that could provide residents with affordable medical and pharmaceutical protocols. I would also like to focus on the climate change agenda, which is, in today's world, a big challenge that mankind faces. And our countries are no exclusion. And we need pure, fresh air, clean water, and good living conditions. In the horizon of 2015, the mortality can increase by 250,000 deaths per year due to malnutrition, malaria, and other diseases. We need further investment in healthcare, water treatment, and nutrition. They will make up to $2 to $4 billion per year, and the development countries will be less prone to tackle the situation unless they develop a system of responding climate change challenges. And as part of our joint activities, we believe that we need to focus on development recommendations for the government agencies due to climate change and its influence on human health in the context of human rights protection. Using this opportunity, I would like to suggest that we review the situation in the area of healthcare service providing, access to healthcare insurance for members of families of those who live in the countries of the Eurasian Ombudsman Alliance, to improve the quality of healthcare services. And in conclusion, I would like to express my gratitude to all the members and participants and the opportunity to discuss relevant issues using this platform for their subsequent solutions. Thank you. Now, I would like to give the floor to the Ombudsman in the Republic of Kazakhstan, Mr. Artur Yermekovich Lastayev. Justice Khodayan, please get prepared. Dear Chairperson, dear Tatiana Nikolaevna, dear colleagues, please allow me to thank you for your hospitality. And I would like to mark the traditional high level of the events organization. And I would like to cordially congratulate Mr. Ali Ahmed Al-Derazi, the chairperson of the National Institution on the Human Rights in the Kingdom of Bahrain, on the accession to the Eurasian Ombudsman Alliance. Welcome to our friendly Eurasian family. And no doubt that today's assembly will be another important step forward to strengthening the situation in the area of human rights. In our countries, the health and life of humans are the supreme values. While treatment is the only thing that can be more expensive than health of a person. So nationals of Kazakhstan can enjoy constitutional guarantees. And the principles for healthcare services are equal for residents of Kazakhstan, foreigners, and people without nationality. And the founding block is the healthcare system. It has seen a dynamic development. 3 years ago, the principles for the rights for healthcare has been implemented and formulated, stipulating the scope of obligatory healthcare. The main focus is on national healthcare organizations. Others are part of private or quasi-public sector. The goal is the transition from the centralized, from patient-focused system. And the main targets include the equal access to healthcare for urban and rural populations. So the statistical data shows how in recent 3 years financing of the national healthcare systems increased in 2.5 times, or 2 times if we calculate per one person. So the number of consulting sessions in narrow medical specialty grew by 20 times. The residents of Kazakhstan use e-Den-Salik electronic government systems that make medical services widely available, improving the system of territorial control in the area of healthcare. So it uses wide powers and it is quite efficient in its use, which the result is, well, a low number of complaints. And we have organizations and institutions where people are isolated from the society, where we get most of the complaints. Due to preventive and response-based measures on daily control, to date, we only got 129 complaints this year, most of them from the penitentiary system institutions. So you will probably agree that this is not too many, that given that we have above 3,000 institutions in the penitentiary system. From July last year, so the pre-detention, the detention centers are part of, and also the penitentiary institutions are united by the system.
So problems do persist with material base, with modernization of facilities, and some of the buildings that were built back in the 40s, they should be upgraded. Also, distance from city infrastructure makes it difficult to access for high-tech medical services. So, but the solution may be using mobile diagnostic stations, and we do use them. At the same time, independence of doctors from the prison authorities is a major benefit in terms of preventing torture and violent treatment. Electronic protocols are used by first-level doctors, and also there is criminal responsibility for violent treatment, not only for torture. So prison sentence for torture can be up to 12 years. So prosecutors oversight and making sure that prisoners have a right for medical services and health. Our cooperation with judicial authorities, with prosecutor's office, and with courts help to review some of the prison sentences because of health reasons. And social services, how they respond to emergencies is a problem for us. Besides those systemic measures, we also work on systemic issues. The General Procurator's Office and relevant authorities rose issues of providing reliable medical supplies to those who have disorders or disabilities. So in conclusion, I would like to thank our colleagues and organizers for this opportunity to have discussion, to share experiences for analysis and detailed analysis and examples. And getting ahead of myself, I support the draft resolution of today's meeting, and I welcome the efforts of the Alliance leadership in terms of sharing its experiences. Thank you for your attention. Thank you, Artur, for your presentation. A very interesting position was presented here. The next speaker is our colleague from Iran, Justice Khadalan. Unfortunately, he could not be present here. So, Mr. Khadayan, over to you. Ваше превосходительство, господин президент, дамы и господа, я очень рад сегодня выступить.
نهادهای آمبودزمانی در هر یک از کشورهای عضو را فراهم می‌کند. ابتدا لازم می‌دانم حملات وحشیانه رژیم صهیونیستی به مردم بیپناه غزه و به خاک و خون کشاندن هزاران نفر از زنان و کودکان مردم بیگناه فلسطین را که نقض بدیهی ترین اصول حقوق بشر توسط این رژیم می باشد رو محکوم نمایم. جنایات صهیونیست‌ها در قبال مردم فلسطین نوعی نسل کشی است و لازم است هر چه سریعتر دولت‌ها، نهادهای بین المللی و به ویژه نهادهای حقوق بشری برای جلوگیری از ادامه این جنایات وارد عمل شوند. در این فرصت مایل هستم در خصوص اهم اقدامات سازمان بازرسی کل کشور جمهوری اسلامی ایران در بخش بهداشت و سلامت با تاکید بر رعایت حقوق شهروندی و صیانت از حقوق بیماران صحبت کنم. حضار محترم، همانطور که می‌دانیم یکی از بزرگترین نعمت‌های خداوند به بندگانش سلامت است و یکی از وظایف اولیه دولت و حفظ و تأمین این نعمت خدادادی است. با توجه به تاکید جمهوری اسلامی ایران بر تأمین بهداشت و سلامت شهروندان، این موضوع نه تنها در قوانین عادی بلکه در اصول مختلف قانون اساسی نیز مورد اشاره قرار گرفته است. از این رو دولت جمهوری اسلامی سیاست‌ها و برنامه‌های متعددی برای تأمین بهداشت و سلامت مردم اجرا نموده و در حال اجراست و سازمان بازرسی کل کشور بر اجرای درست این برنامه‌ها و سیاست‌ها نظارت می‌کند. نکته بسیار مهمی که در بحث سلامت باید مورد تأکید قرار گیرد این است که تحقق کامل سلامت در هر کشور مستلزم همکاری سایر کشورها و نهادهای بین المللی است. لذا مسئولیت کشورها از تحریم‌های بین المللی در این حوزه موضوع بسیار مهمی است که باید مورد تأکید قرار بگیرد، چرا که متاسفانه برخی کشورها با نقض حقوق بشر تحریم‌های دارویی و پزشکی را ابزاری برای فشار به کشورهای مستقل قرار دادند. موضوع سلامت و بهداشت در جمهوری اسلامی ایران در اصول قانون اساسی سند چشم‌انداز 1404 سیاست‌های کلی سلامت ابلاغی مقام معظم رهبری و قوانین عادی مورد توجه قرار گرفته است. در بند 12 اصل سوم قانون اساسی دولت موظف به رفع محرومیت در زمینه بهداشت و تعمیم همگانی بیمه شده است. در سیاست‌های کلی سلامت ابلاغی مقام معظم رهبری به افزایش و بهبود کیفیت و ایمنی خدمات و مراقبت‌های جامع و یکپارچه سلامت با محوریت عدالت و ارائه خدمات فراتر از بیمه پایه و کلیه اقشار جامع به ویژه اقشار نیازمند تأکید شده است. در قوانین عادی نیز به امر سلامت معلولان، سالمندان، مادران، کودکان و سایر اقشار آسیب‌پذیر تأکید شده است. صیانت از حقوق بیماران نیز از جمله موضوعات مورد توجه در جمهوری اسلامی ایران هست. یکی از اقدامات مهم در این زمینه تدوین منشور حقوق بیمار می باشد که ابتدا در سال 1380 تدوین و ابلاغ شده و بعد از مدتی این منشور مورد بازنگری قرار گرفته و کاستی‌های آن برطرف و در آبان سال 1388 توسط وزارت بهداشت، درمان و آموزش پزشکی جمهوری اسلامی ایران به تمامی دانشگاه‌ها ابلاغ گردیده. در این منشور که شامل محورهای 5 گانه است، تمامی حقوقی که بیمار از آن برخوردار است احصا و مورد تأکید قرار گرفته است. از جمله محورهای این منشور دریافت مطلوب خدمات سلامت حق بیمار است. محور دوم، اطلاعات باید به نحو مطلوب و به میزان کافی در اختیار بیمار قرار بگیرد. محور سوم، حق انتخاب و تصمیم گیری آزادانه بیمار در دریافت خدمات سلامت باید محترم شمرده شود. محور چهارم، ارائه خدمات سلامت باید مبتنی بر احترام به حریم خصوصی بیمار و رعایت اصل رازداری باشد. و محور پنجم، دسترسی به نظام کارآمد رسیدگی به شکایات حق بیمار است. خانم‌ها و آقایان، سازمان بازرسی جمهوری اسلامی ایران طبق قانون اساسی نظارت بر حسن جریان امور و اجرای صحیح قوانین در دستگاه‌های اجرایی را بر عهده دارد. برای انجام این مأموریت این سازمان بر انجام درست وظایف قانونی دستگاه‌ها نظارت و از آنها بازرسی می‌نماید. یکی از موضوعات کلانی که همواره در دستور کار این سازمان قرار داشته بحث سلامت است. این سازمان در سالهای اخیر در موضوعات مهم ذیل از دستگاه‌های ذی ربط بازرسی نموده و یا بر عملکرد آنها نظارت دارد. اجرای پوشش بیمه همگانی که نتیجه آن اعلام پوشش دهک‌های پایین جامعه به صورت رایگان و افزایش پوشش بیمه پایه بوده است. نظارت بر نحوه تأمین، توزیع و پایش اقلام دارویی و رفع کمبودهای دارویی که نتیجه آن شناسایی شرکت‌ها و افراد مخل زنجیره سالم توزیع دارو و معرفی آنها به مرجع قضایی بوده است. نحوه توزیع نیروی انسانی متخصص مورد نیاز مراکز بهداشتی و درمانی در سطح کشور که نتیجه آن اصلاح نحوه پذیرش دستیاران تخصصی و توزیع متخصصین در جامعه بوده است. نظارت بر تأمین ایمنی مواد خوراکی و آشامیدنی که نتیجه آن ارسال گزارش به رؤسای قوا و ارجاع آن به دستگاه‌های مربوط در جهت اصلاح امور بوده است. نظارت بر نحوه انجام واکسیناسیون که نتیجه آن انجام هماهنگی لازم بین بخش‌های ذی ربط و رفع مشکل با افزایش تولیدات واکسن و استفاده از ظرفیت شرکت‌های دانش بنیان بوده است. لازم به ذکر است مشکلات ایجاد شده در این حوزه ناشی از تحریم‌های ظالمانه آمریکا و اختلال در تأمین ارز مورد نیاز برای واردات دارو و تجهیزات واکسن سازی بوده است. نظارت بر وضعیت تأمین خون و فرآورده‌های خونی در کشور که نتیجه آن رفع مشکلات تأمین کیسه‌های خون و فرآورده‌های خونی بوده است. نظارت بر اجرای تکالیف وزارت بهداشت در قانون حمایت از اطفال و نوجوانان که نتیجه آن برقراری پوشش کامل بیمه‌ای برای تمام افراد مشمول معرفی شده از سوی سازمان بهزیستی، اطفال و نوجوانانی که با خانواده خود زندگی می‌کنند و اطفال و نوجوانان بی سرپرست و بد سرپرست بوده است. نحوه پاسخگویی و رسیدگی به شکایات در حوزه سلامت توسط وزارت بهداشت که نتیجه آن اصلاح ساختار مرکز پاسخگویی به شکایات و کاهش زمان پاسخگویی و رسیدگی به شکایات بوده است. سازمان بازرسی جمهوری اسلامی ایران در سال جاری نیز نظارت و بازرسی در 4 موضوع کلان شامل پزشک خانواده، پوشش بیمه همگانی و امنیت غذایی و قیمتگذاری و توزیع دارو را در دستور کار خود قرار داده است. عالی جنابان، سازمان بازرسی جمهوری اسلامی ایران به منظور تحقق کامل حقوق شهروندان و جلب رضایت آنها علاوه بر بازرسی از دستگاه‌های متولی بهداشت و درمان در ایفای نقش آمبوزمانی خود گزارش‌ها و شکایات شهروندان در این حوزه را دریافت و مورد رسیدگی قرار داده است. بر این اساس در 6 ماهه اول سال جاری در مجموع 1163 شکایت و گزارش سوء جریان مربوط به حوزه بهداشت و درمان رو دریافت نموده که از این تعداد 492 فقره شکایت و 671 مورد گزارش سوء جریان رو مورد بررسی قرار داده. در همین مدت تعداد 1008 مورد از شکایت و گزارش‌های فساد مورد رسیدگی قرار گرفته و فرایند آن به اتمام رسیده و تعداد 155 مورد در حال رسیدگی می باشد. از توجه شما سپاسگزارم.
Благодарю вас за обстоятельный и интересный доклад о вашей деятельности.
Thank you for this detailed presentation. Hopefully you'll be able to participate in person next time. So I will ask Mehmet Babulzada, Higher Commissioner for Human Rights in the Republic of Tajikistan. Thank you so much. Dear participants of the meeting of the Eurasian Ombudsman Alliance, dear colleagues, ladies and gentlemen, first of all, I would like to welcome all the participants of this meeting and thank the organizers of this meeting and personally Madam Tatiana for the invitation to this meeting. I'm confident that today's forum is a great platform to discuss these problems, to share practices and experiences and strengthen cooperation and encourage human rights protection, especially with regard to healthcare and medical services. I would like to use this opportunity and share this opinion that the accession of the Kingdom of Bahrain to the Eurasian Ombudsman Alliance is an event, a step for this full-fledged cooperation and ensuring that basic human rights are observed and protected in all the Eurasian space of the Alliance. We are very happy that another state joins us. Eurasian Ombudsman Alliance expands and has more strength to protect human rights. Dear colleagues, right to health is a foundational human right and is an integral part of our understanding what constitutes a dignified life. It's one of the first international universal declaration is one of the foundational documents where this right is established in Article 25, where it talks about satisfactory life service, and health is one of the key rights for every person. Human rights violations or the lack of attention to them lead to serious consequences for health. Discrimination in medical services among healthcare professionals and as well as among patients is a major barrier for access to medical services and impacts its quality. Human rights violations not only have negative impact on health, but for people with disabilities or for women with HIV or for drug users. Medical institutions are those places where they face higher risks of human rights violations, including forced medical services, but equality is foundational, and it's true also of healthcare and services. So ensuring human rights is a great priority for the Republic of Tajikistan. During the period of its independence, it's achieved multiple results in all the areas, including healthcare and medical services. Currently, healthcare system is going through significant changes. We fundamentally reform healthcare system with the aim of improving quality and accessibility of medical services with all the modern and state-of-the-art achievements and technologies. We run 12 national programs on such as diabetes, cardiovascular disease, HIV, maternity diseases, and infant diseases, etc. So to fulfill the national programs, it depends on our personnel. So 2019, that's when the pandemic started. Thanks to the courage and the qualifications and of our medics, thousands of lives were saved, and an epidemic of coronavirus was stopped in multiple countries of the world. The government of the Tajikistan Republic, during the pandemic period, took daily measures to prevent the spread of this disease of COVID-19. It should be noted that Human Rights Commissioner in Tajikistan timely responded and provided necessary legal support to make sure human rights were observed during the pandemic. The Human Rights Commissioner, in the March of 2020, created its own group to act on the instructions. The Office of Human Rights Commissioner at that time closely cooperated with the Ministry of Health, with the Ministry of Foreign Affairs of Tajikistan, and the staff of our Human Rights Office during the pandemic systemically conducted meetings and conversations with population to make sure the rights were observed. Also check sanitary conditions in places, making sure human rights and freedoms were provided for. Also, the participation of Ombudsman of the Russian Federation, we were able to provide help to our fellow citizens who suffered from those diseases during the pandemic. Dear colleagues, protection of basic human rights in the area of healthcare is a fundamental right. It's guaranteed by the Constitution of Tajikistan. Healthcare rights are listed in our laws that define and regulate legal and organizational aspects of providing medical health. Last year, we adopted a healthcare code that regulates public relations and other relations in healthcare. At the state level, we also, to improve and provide best services, we adopted a national strategy of Tajikistan in human rights until 2038, an action plan for 2023 and until 2025. In that document, we plan a series of actions that should help strengthen human rights and their protection in the country. This document, besides other areas of law, focuses on human rights and specifically the right for health. So Article 11 speaks of human rights for health, for sanitary conditions, to Article 12 for physical and mental health, and Article 14 rights of disabled persons and how they can be guaranteed. Also, the right for health is part of the strategy for Human Rights Commissioner for 2021 until 2025 is one of the priority areas for the Ombudsman institution in Tajikistan, also ensuring infant lives for health and life are constantly monitored by Human Rights Commissioner. So to ensure infants have a right for health and access to medical services, Human Rights Commissioner ran some audits to how medical services are provided in various areas of the country. Besides those audits, the situation for infants with the Ombudsman organized meetings with authorities and with parents. Information was provided to them on the situation, on the legal framework, on fulfilling international obligations, and also implementation of regional and government programs. We receive complaints in our Ombudsman office related to healthcare, 30-40 complaints, mostly related to complaints on free medicines, free medical services, and checkups. Also, Ombudsman plans to organize monitoring of medical institutions, also centers for disabled people and prevention centers, including HIV for HIV patients. So also centers for elderly and disabled people. We did some monitoring and audits to make sure human rights of those people of those persons are observed. One of the factors of risks of disease spread are work migrants that come back from abroad. Analysis shows that diseases among those people are on the rise from year to year. To identify their infections, we do checkups. In 2019, Ombudsman in Tajikistan met with a special advisor of UN on HIV, Professor Michel Kazachkin. So at the meeting, we discussed achievements and problems in healthcare. So Commissioner of Human Rights in the Republic of Tajikistan has made many steps to ensure protection of human rights in the context of healthcare and providing medical services. Thank you for your attention. Thank you so much.
Выражаем
We would like to express our gratitude for finding time to come to Moscow in person this time and present this highly detailed presentation. Now I would like to hand it over to Mr. Zoran Pashalich, the defender of our interests in the Balkans.
Opportunity to address you on this meeting, and please accept my apologies for not being able to attend in person due to some previous commitments. Health is an investment and a crucial resource of society and the individual. The right to health as a basic human right represents a complex set of various issues from the field of life. The health of the population must be seen as a concept that encompasses the broad needs of society on the one hand and the situation of individuals on the other. In the preamble to the Statute of the World Health Organization, health is defended as a state of complete physical, mental, and social well-being, and not merely the absence of disease. The aforementioned definition points to the need to develop awareness among citizens about the broad scope of the concept of health, which goes beyond the absence of disease. First, develop self-awareness in people regarding the human right to health. Second, treat the concept of health as a basic human and a social need. Third, connect health with basic human rights. The Universal Declaration of Human Rights, adopted on 10th December 1948, in Article 25, among other things, stipulate everyone has the right to a standard of living adequate for the health and well-being of himself and of his family, including food, clothing, housing, and the medical care of necessary social service. The preamble of the mentioned Declaration of Human Rights emphasizes the need that the common standards in prescribers should be encouraged by all peoples and all nations, so that every individual and every organ of society, keeping this declaration constantly in mind, would strive to realize these rights and freedoms. The aforementioned Declaration of Human Rights and other ratified international documents would be sufficient to regulate social relations in an agile society. Unfortunately, we live in a time and a world that less and less accepts moral standards, the respect for ethics over law and technology, as well as people over things, that is, spirit over matter. In the contemporary world, many questions are devoted to the understanding of the relationship with medicine and the realization of human right to health and health care. The social, moral, and legal norms that regulate the health care activity with their instrumental character achieve social goals, ensure the smooth operation of public service and the healthcare organization, as well as individuals in them. In the wider social community, including in healthcare, we are faced with various dilemmas and different situations that require different solutions. There is a constant striving for progress, but there are also dangers of conflicts of individual interests with broader social interests, which can be especially manifested in the area of medicine, which is based off the highest scientific, human, and technological knowledge and values. The improvement of health can be seen as the process of empowering people to take control of their environment and thereby change and adapt it for the purpose of improving healthcare standards. Inequality in health as consequences of inequality of life opportunities can be reduced by means of international solidarity mechanisms through cooperation and creation of a strong social environment by using social support programs and strengthening the capacities of the so-called vulnerable groups in order to achieve a common goal, which is health and dignified life for all through mechanisms of fairness and solidarity. Health is a basic human tool for personal progress, development, and dignified life, and thus indirectly for the development of the entire community. In the already growing gap between the rich and the poor, the task of all of us is to achieve equality, stability, and security in the provision of health care. With the principles of non-discrimination as a basic principle, special protection should be provided to the so-called vulnerable groups of society: women, children, and adolescents, people with disabilities, migrants, etc. In times of war, human rights are threatened in several ways, and it is difficult to ensure the right to the safe life, the right of freedom, and the right of health. Therefore, I must repeat that the right to health does not include only the right to be healthy, but closely related to all those rights that ensure the minimum for an individual to achieve a dignified life and personal progress. Thank you very much.
Благодарю.
Thanks, Zoran, for this informative speech. dear Jamila. Thanks for your support and assistance. Dear friends, I would like to invite you to have a break. You are all invited to a coffee break, and then we will continue our assembly in 30 minutes. Thank you. Beckham to go on acting as a moderator. Thanks a lot. I would like to give the opportunity to speak to the Commissioner of the Oli Majlis of the Republic of Uzbekistan for Human Rights, Ms. Firuza Eshmatovna. So, Ms. Sangi Sharaf Dondov, please get prepared. Thank you, dear Tatiana Nikolaevna, dear delegates to the Assembly, dear participants. First of all, I would like to express my most sincere gratitude for your invitation to attend this highly important event, and also for the opportunity provided to share our experience and meet our colleagues from the Eurasian Ombudsman Alliance and colleagues from other countries. Also, I would like to join our colleagues and congratulate Mr. Ahmed Al-Derazi on the occasion of joining us and wish him all the best in his work. I really hope that these events for the 2 days organized by the Russian Ombudsman Office will be productive for us all. The right for health is one of the fundamental rights stipulated for by the Constitution of the Republic of Uzbekistan. In the new constitution enacted on the 30th of April 2023, the Republic of Uzbekistan is declared a social state. It is an indication that the country pays the uttermost attention to the health and healthcare prevention. So in 2023, over 10,000 of requests were filed to the Office of the Ombudsman of the Republic, and 105 of them were related to the healthcare. And out of them, 27 of them were reviewed by the Ombudsman as an object of parliamentary control. In 22 cases, responsible persons were made responsible under the Code of Administrative Responsibility of the Republic of Uzbekistan, and in 4 cases, site visits were fixed to assist citizens, and the assistance was provided in getting medical orders and in rendering services for getting free medicines. So, based on requests to Ombudsman, 30 million Uzbek sums were assigned to address requests by the citizens. Reviewing the complaints on the healthcare service qualities showed that further education programs in medicine and healthcare are required for lawyers, and also special programs are required for healthcare professionals. In line with programs addressed for remote areas, regular representatives of the Ombudsman provide regular healthcare services to residents of the regions in remote areas I mentioned. They involve different medical disciplines like otolaryngologists, ophthalmologists, and other healthcare professionals. In our country, such conditions as the right to choose the doctor and the healthcare institution, the preliminary voluntary consent, the right for medical aid are guaranteed in our country. In general profile and medical education institutions, there are guaranteed methods for gene engineering and a range of measures aimed at ensuring integrity of a person and the fundamental human rights in the context of developments in biology and medicine. The human rights should prevail over the developments in science and technologies. Professional requirements and standards must be followed, and medical intervention can only occur after a voluntary agreement of a person involved. In line with this, it makes sense to investigate improvement of independent monitoring mechanisms in the area of healthcare services provided to populations. There are some facts of violations in the interactions between healthcare professionals, a doctor, a pharmacist, a nurse, can take place at all stages of healthcare provision. So, improvement of healthcare should involve monitoring of human rights,
подготовка специалистов в области
improving awareness in the area of legal rights in healthcare, and the experience of improving human rights protections of patients has a legal framework behind it. You can get updated on the practice in healthcare institutions of the Republic of Uzbekistan. The Republic does a lot to improve the level of accessibility of medical assistance, and the high priority is the goal of high standards of medical assistance in line with the global standards. Even in the most developed countries, you come across problems with discriminations of human rights in the area of healthcare and medicine. Over time, the relations between the consumers of medical services and medical service providers experience an evolution. And there is an exchange of best practices with colleagues from other countries, and it is a step towards the progress of the well-being of the humanity. And I would like to thank Tatiana Nikolaevna once again for developing this platform and also for development and improvement of this platform, and also for organizing an event at such a high level. Also, we would like to wish all our colleagues good luck in their activities. Thank you for your attention.
Благодарю вас за содержательное выступление.
Thanks for a very informative presentation. And topics you mentioned are, of course, highly interesting for all the participants. And now the floor goes to the Commissioner of the National Human Rights Commission of Mongolia, Ms. Sangish Haraf Dondov. And I would like Mr. Ali Ahmed Alderazi to get prepared. Dear Tatiana Nikolaevna, dear comrades, the National Human Rights Commission of Mongolia, in cooperation with the World Health Organization, is aimed at human rights protection in the area of healthcare and medical assistance. The healthcare system of Mongolia is represented by public and private healthcare institutions. We have healthcare insurance system and the system for investigating infectious diseases, a center for maternity protection, a center of pharmaceutical information and non-traditional medicine. Like in Russia, in Mongolia, we have centralized medicines, and as part of obligatory healthcare insurance services, all residents are entitled to help. As of 2023, we have 4,500 healthcare institutions, including 209 family hospitals and 29 regional general purpose hospitals. At the level of healthcare centers, the family centers provide healthcare services regardless of the population number, and they cater from 8 to 30,000 people. From the point of view of accessibility to healthcare services, the location of a hospital and equipment of the building, the adequacy of medical headcount, and the assistance to people with disabilities, so they are all aimed at high level of medical services. The quality of healthcare and medical services is ensured by due equipment, quality and safety, sterilization, and infection-free. We have shortage of doctors and healthcare professionals. As of 2023, in Mongolian healthcare system, we have 54,000 doctors and healthcare professionals, and 23% of them work in the governmental public healthcare educations. And 23% of them consist of general practitioners, and we have the equal percentage of nurses. We have a substantial number of pharmacists, and 3% of them are pharmaceutical employees of lower level. We have 36,000 healthcare professionals involved in the private sector. Apart from a doctor, we have healthcare professionals focused on children, women, otolaryngologists, and professionals who work with disabled people. Due to a shortage of highly skilled, experienced personnel, we face a lot of problems in the neonatal area due to the fact that doctors and healthcares cannot provide their services on a regular basis. And this is the area where we need to make a point. Patients with disabilities have access to family health care, and patients who use wheelchairs have problems with getting to outpatient clinics, although there are special ramps for their access. And also a person with buggy for a child cannot reach and get access to such family healthcare centers. There is a lack of special paths for visually impaired people. This is a problem common for such family health care centers. So they don't have any lifts. And this is a big problem all our family healthcare centers have. There are no access ways for patients on wheelchairs, and wheelchairs cannot freely get through the parking lots which are busy. and there is a need of special parking lots with signage for disabled people. So the lack of special parking lots for disabled people is another challenge. Assessing the labor rights, the professionals in the healthcare system during the recent 3 years, the times of the pandemic, so they revealed a number of conflicts between healthcare professionals and residents with verbal abuse and physical violence. However, doctors have to work overtime and experience high workload when they cater for job duties of several professionals instead of one. Many medical professionals suffered from stress at workplace. 81% of doctors and nurses in the centers of family medicines, and also 65% of healthcare professionals in general purpose centers experienced stress from conflicts with patients, high stress, and workload. Sometimes the scope of doctor and nurse were combined. So our survey was focused on how to improve their work conditions, on how to offer them extra bonuses. 80% of doctors and nurses who were respondents of a survey for the family healthcare centers, so they said that they would like the work conditions to be improved. The reason for their lack of satisfaction was the need for innovations, offering bonuses, and it was quite often a problem for the family healthcare centers. Thanks for your attention. Thanks a lot for your presentation and contribution in our ongoing discussion. Now, as a fully fledged member of the Alliance, we would like to listen to the chairperson of the National Institution for Human Rights of the Kingdom of Bahrain.
In Bahrain, the population, we have around 1.5 million people. Out of them, 55% are citizens, and around 45%, almost, are expatriates. Now, as per the Constitution of the Kingdom of Bahrain, Article 8, it's guaranteeing the right of health for every citizen, with the state establishing hospitals and health institutions for treatments. Now, the Kingdom of Bahrain priority health service for all citizens are free of charge. And it is very important that all the expatriates, they should have a proper coverage of medical insurance. The Ministry of Health provides comprehensive health care through various facilities, like medical complexes, a governmental hospital, including psychiatric, cardiac, and kidney disease centers, hospitals for maternity and elderly care, military hospital, university hospital, private hospitals and clinics. Now, we have established something called National Health Regulatory Authority. The government established the National Health Regulatory Authority, which we call it NAHRA, as independent regulatory body in 2010. That means all the hospitals, whether they are governmental hospitals or non-governmental, they should be approved by this authority, and this authority works as totally independent from the government. To regulate the provision of health care in Bahrain and ensure continuity, efficiency, and safety in developing health services, both in the governmental and the private sector. All the specialists, all the doctors, all the consultants must be licensed by this authority. 100% of all enabled hospitals in the Kingdom of Bahrain have been accredited by these facilities. And by the way, if anyone lost his license, and they're very easy to lose the license because you have to have a regular practice and certain categories they are having for it. Now, we have also primary health care that is in the high network of medical centers spread throughout the government and the kingdom. Program of promotion, health behavior, early disease detections, and diagnosis, treatments, and rehabilitation. Family medical services, community health nurses, social workers in all health centers. Preventive services for mother and child care. We have also the secondary health care to provide provided by medical complex and other public hospitals, various medical services for inpatient, department for accidents and emergency services. Now, in COVID-19 pandemic, Bahrain has a very high response. In Bahrain, we have taken precautions to protect the right of health, establishing isolation and quarantine centers, provide free medical care for all infected individuals, whether they are citizens or expatriates. We treat them all free. Provide free vaccination for all population, including, as I said, the citizens and the residents. In fact, even the tourists at that time, they got also vaccination free of charge. Develop Be Aware app for virus awareness and detection tracing. Implement remote work and distance education. Implement safety measure in correction centers, such as virtual visit, prevention of crowd, isolation, sterilization, and vaccination. Now, we support also for prisons with disability. The National Institute for Human Rights in Bahrain assists individuals in the difficult situation, including disabled people, a child without parents, and refugees. Now, we have also worked very hard in transferring the healthcare for Yeminis. In accordance with the recommendation of the National Institute of Human Rights, the Ministry of Interior transferred the healthcare responsibility in detection center from the Ministry of Interior to Ministry of Health, and now it is under the Ministry of Health. Also, we always ensure and monitor the comprehensive health care for Yemenis and protect their rights for health. Thank you very much.
Благодарю вас за...
So may I add something to that? Actually, I'm going to share my impressions, how we worked during the COVID pandemic. And it's a relevant topic today. During the COVID pandemic, to minimize disease rates and disease spread, detention centers and penal colony employees worked in shifts. They would come for a week to work there, so to stop the spread of the virus. And there were some visits were restricted or even banned on the part of public commissions. So you have preventive measures for the most part, and you have assistance. And for us, it's people from public bodies that can freely attend the detention centers and penal colonies, but they were prohibited from that during the pandemic. But we kept receiving complaints on medical services, on conditions in prisons, and my colleagues and myself were the only ones who had access to penitentiary institutions. We had special suits. We would go through testing for COVID, and in that way we would gain access. During that time, we faced that general rules on meetings and on sending parcels to prisoners did not work. And we proposed to the global community two things. Firstly, to have special conditions in place for parcels to send with larger volumes, because personal meetings are banned during that time, and not to close borders for our own citizens, for them to be repatriated, because transport stopped functioning. This is what we faced. And as a result, people at airports, they were facing greater threats as a result. Unfortunately, an international convention was not adopted. The COVID topic is not there, but most likely we will face human rights issues during epidemics, and it can be COVID or it can be another infectious disease. And it's important for us to share how to work in prisons in those conditions. And our authorities, government institutions, and they responded to our proposals in terms of volumes of parcels that could be delivered. So something that they can mail, send by mail, not bring personally. So that was just our experience that I wanted to share. Thank you. So next speaker online. So the head of the for healthcare and youth policies of the national, Yelena Makarina Kibak from the Republic of Belarus. The floor is yours. Dear Tatiana Nikolaevna, dear participants of the session, I would like to welcome all the participants and thank for giving me this chance to share how we protect human rights with regard to healthcare in the Republic of Belarus. Ensuring the right for health is an obligation of the Belarusian state. It's part of the constitution that says that citizens of the Belarus Republic are guaranteed the right for health protection, including free treatment paid by the state, as the law says. but the citizens take care of their own health. The Constitution of the Belarus Republic also guarantees the right for social services to citizens if they lose health, including diseases, disability, loss of working capacity, and also when they defend public or government interests. The constitutional rights and freedoms are guaranteed, and it's the basis of our policies in the Republic of Belarus. The Republic of Belarus is one of the few countries in post-Soviet area and in the Eurasian region where budget funding of healthcare system is provided. It's adapted to socioeconomic conditions of our country. The particularity of our healthcare system is the presence and functioning of medical institutions which are state-owned and private as well. Non-government sector constitutes over 7% of all medical services. The share of budget for healthcare over the last few years has been stable, and it's about 5% of GDP, which is in line with recommendations of World Health Organization and helps to achieve sustainable development goals of our country. Currently, the Republic of Belarus has 15 Republican science and medical centers, 540 hospitals, 281 outpatient clinics, hundreds of sanitary organizations, and a chain of state-owned drugstores. We also have a network of dispensaries for outpatient care, also to provide access to medical services in remote areas and rural areas. We implemented mobile crews. We work with 47 mobile medical complexes. We developed routes for their considering the location of specific villages, and also we established the frequency of visits depending on the number of residents in specific areas. Mobile medical complexes do checkups, prevention, so when they're inspected and medical medicines are prescribed. Also, primary medical aid doctors, family doctors were implemented. So primary aid in 2022, that institution was developed 100%. So a project called Friendly Hospital helped to organize the use of medical records with development of personal profiles with electronic medical prescriptions being in place helps to facilitate many processes and improve quality of medical services provided. In the last few years, the country has seen low levels of infant mortality. We see rare cases of mother mortality. In 2022, from the budget, we completed extracorporeal insemination, which in the number of 1800s, cardiovascular interventions, prosthetics of and uses endoprosthetics for own production. In 2022, we conducted over 400 transplantation surgeries, and 15 of them were done to kids. Prevention is key for protecting health of our population. We totally reviewed our approaches to checkup, including working with patients with chronic diseases. New approaches to checkups help resolve some of the problems, like spread of infectious diseases and early detection of diseases. The country runs a project called Healthy Cities and Healthy Villages, which runs in multiple locations. We actively develop telemedicine to reduce the risks of disease spread, we prevent non-infectious diseases as well. So the average weight of people with tumors, non-malicious tumors, was reduced. We also do prenatal screening for all babies and testing for multiple disease, for inborn, for orphan diseases, etc. For early detection of pathologies, the country conducts biochemical and DNA diagnostics. We actively develop COVID studies. We also evaluate quality of medical services. And over the 3 years, we've been studying complaints of people. Thank you for your attention.
Dear Ludmila Eduardovna, thanks for that detailed and informative presentation on your activities. Now the word goes to the authorized representative for human rights in Turkmenistan, Ms. Yazdursun Gurbanazarova. Ms. Gurbanazarova, the floor is yours. Thanks for this opportunity to speak before the Assembly. Dear colleagues, dear Tatiana Nikolaevna, I'm happy to welcome you at the 8th Assembly of the Eurasian Ombudsman Alliance, and I would like to cordially thank you for the invitation to join this important meeting. So we gathered to discuss relevant issues in the area of human rights protection, in healthcare and medical assistance. This will be the chance for us to exchange mutual experiences. And now I would like to cordially welcome the National Institute of Human Rights Defense of the Kingdom of Bahrain for joining the Eurasian Ombudsman Alliance. Of course, your involvement will enrich the alliance with new ideas and experience. Health is one of the essential rights of a human being, and the access to medical assistance is an integral part of this right. In the realities of the modern world, in the context of the COVID-19 pandemics, the issues of medical and healthcare services are topical as ever. In Turkmenistan, we focus special attention on healthcare and well-being of all our residents. It includes daily care about provision of high-quality modern services. Based on the principle that health care protection is a part of the constitutional standard, our healthcare system delivers full-fledged activities to provide equal rights of citizens for healthcare services, for their accessibility, the priority for protection of childhood and maternity, the protection of rights of disabled people, the principles of universal all-round provision of healthcare services are the basic principles in the Republic of Turkmenistan. We have the national program called Tarlak, or Health, adopted in the Republic of Turkmenistan, with the implementation plan developed for the period from 2021 to 2025. It's aimed at improving the longevity of the population and prevention of diseases, creation of a modern and efficient healthcare system. The country adopted bylaws and national programs in the area of healthcare. They are regularly updated based on requirements of the day and recommendations from the international organizations. There is a system of measures for struggling infectious diseases for 2021 till 2025. There is a national strategy, Healthy Mother, Healthy Child Mean, Healthy Future, a program focused on protection of maternity and children health for 2021-2025. Also in 2022, there was a ruling of the head of state that approved the national program on turning Turkmenistan in tobacco-free country by 2025, and also a strategy on improvement prevention measures for the use of vitamin B in 2021-2025, extended by a plan of activities for implementing the arrangements. There is a large-scale work on reforming the national healthcare system in the context of strengthening international cooperations, and reputed organizations such as the United Nations and targeted structures like the World Health Organization act as our partners, which is proved by the National Cooperation Program between the Republic of Turkmenistan and the United Nations for the period from 2021 till 2025. It focuses on strengthening interaction in a number of areas. Also, UN system supported implementing national policies and strategies, for instance, in the area of food and nutrition and equal development of regions for 2021 to 2025, the national program of combating tuberculosis, and supporting a national initiative on developing hospitals for children. Also, a regional program for partnership in food and nutrition areas for 2021 to 2025 was implemented. In 2022, the Republic of Turkmenistan acted as a chair in the secretariat of the organization. It's essential to use positive experience accumulated by world and national healthcare system to meet the goals provided for in the national program. And the community organization of the doctors of Turkmenistan was established. The protection of health of children and mothers is a key priority in the program. And our country joined the main international conventions and strategies aimed at improving children's health. In all regional centers, in all vilayas, and in the city of Ashgabat, a number of centers for children and mothers' health protections were commissioned. They were equipped with modern technological features, and new vaccines and injections were introduced to reduce mortality in children and mothers. And there is a charity foundation named after Kurban Muhamedov, established in order to support the new generation to contribute improvement in the living standards and health conditions of children. Thanks to the foundation's complex medical operations to orphans and children from poor families are financed. During the last years, the 92 operations for orphans and children from poor family were carried out, and they were financed by the charity foundations. And 23 children went through a medical checkup. Currently, in our country, some children need cardiac operations, and to treat children with heart disorders and pathologies, modern aortic equipment and devices are used. And during the reporting year, 400,000 American dollars were assigned. And it should be noted that this large-scale work in the area of healthcare manifests our care for the health of individuals. As you see, dear colleagues, the Republic of Turkmenistan strives at improving the level of healthcare assistance, and we continuously work on improving the levels, and we support programs on retraining our doctors and healthcare professionals. But like in other countries, we face challenges related to health protection of our citizens. They have to do with accessibility of healthcare services, especially in remote areas. And they are also about the lack of standards and professional ethics. We should focus on cases where patients' rights are violated, and we should help them to sort out their daily problems. We systematically carry out ongoing monitoring, and site visits which are part of the monitoring system help us to identify the facts when patients' rights are violated, and we take measures to rule them out, and it helps to protect patients' rights and improve the overall quality of healthcare services in the country. And during the last year, the Ombudsman's office received only 3 written complaints, which makes just 0.9% of all complaints we received. So it was less than 1% of total oral requests were received, and they were all reviewed in the legal order and sorted out. Apart from that, the Ombudsman's office pays serious attention to important questions as reproductive health and gender equality, and our efforts are aimed in ensuring gender equality and raising awareness in such issues. The UN Foundation on Populations Equality, we deliver workshops and do services assisted by public and non-governmental organizations that work on gender equality and reproductive health in the regions. It allows to broaden the range of stakeholders and exchange experience in this important area. Dear colleagues, dear delegates, this possibility to take part in our today's assembly is important for us because discussion on important issues and exchange of experience plays an important role in protection of human rights and freedoms. And in my conclusion, I would like to thank you once again for this kind invitation, and I would like to wish you health well-being and all possible success in your important work. Many thanks for your attention. Thank you for this informative information with practical cases. Dear colleagues, we are over with the presentations as provided by our agenda. Thanks for your vivid examples and cases. Maybe some of our guests would like to speak up now. Dear Ms. Jamanbayeva, thanks a lot for your help with moderation. So now I would like to draw some conclusions. But before we close our work, I would also like to focus on one important point. Today, when military operations are ongoing, I would like to address the International Committee of the Red Cross and ask them to offer proactive assistance in medical aid to servicemen which turn out to be prisoners of wars, to civilians that become hostages. They should strictly follow to the standards of Geneva Conventions on inadmissibility in non-provision of medical health to wounded and ill people who find themselves in such conditions. During today's conference, we heard a number of very interesting proposals, and this exchange of opinions was of paramount importance for us to improve our work. Our colleagues shared their inputs. We learned that there are codes of health acting in a number of countries, and it's very important for us to have all the collection of standards required for regulating the issue. In some countries, there are concepts of patients' rights protection. And in my personal opinion, the experience of our colleague, the Ombudsman of the Kyrgyz Republic, that there is a special service for patients' rights protection exists and is attached to the Ombudsman's office. And it is based in targeted healthcare establishments for mentally challenged people. These are special institutions, and it's important that an independent service should support their right for integrity of their property, for assigning a special category of disability to them, for their right to contest their position, their stance in legal transactions. Our colleagues mentioned earlier today that healthcare protection and medical assistance should be based on preventive mechanisms created in the republics of Uzbekistan, Kazakhstan, Turkmenistan, which are independent from medical agencies and other governmental agencies, and they can regulate all violations as described by citizens. Our colleague from Kazakhstan, I think, mentioned a very important point, that their initiative was a starting point to review the prosecution measures. And it is quite essential for us in Russia. And today, on the 17th of October, the State Duma reviews the law passed by the Supreme Court of the Russian Federation on restriction of using detention as a prosecution measure by the court to a certain category of citizens. And our colleague from Iran made an important emphasis on the fact that complaints of citizens related to health should get a priority in terms of deadlines of reviewing the applications. The timeline should be reduced.
From my perspective, it was a very interesting proposal. Actually, it was kind of a leitmotif of all ombudsmen and their speeches that we focus mostly on helping vulnerable groups of population. It is our job to pay attention to those who do not have sufficient funds to do it, to ensure their health, and to avoid discrimination between different groups of population based on their material situation. So the question was raised about providing drugs and medicine to young children and disabled persons, and climate change and healthcare. So corresponding things to right for health, other rights corresponding to that should also be protected and observed. In presentation of Ombudsman in the reports, they noted that national program like in Turkmenistan, so of improving immunity of the population in 2025. It seems interesting and new to me, something that you can borrow and follow. My colleague from Iran also paid attention to admissibility of adding to sanction list of medicines and excluding patients from the list waiting for surgeries in other countries if that person comes from a sanctioned list. Also, the use of mobile diagnostic stations. This is a good experience for penitentiary institutions, and my colleague from Kazakhstan mentioned those. And we also have such experience. It would be good to have, as well as for other countries. I do think that we may also identify a couple of topics and to do general monitoring for them, to propose to international bodies our vision on protection of human rights from our perspective as Eurasian Ombudsman Alliance, how to improve healthcare and related human rights. Dear colleagues, in a different room here, there is a large group working. Those who come from our body, those who document all the proposals, they bring those materials to me, and I propose that draft resolution that you preliminarily received, it should be adopted as a basis, and we can modify it considering all the proposals and comments and your experiences that have been presented here today, and we can pass it on to our group. Ilya is here, so he's the first deputy of the head of our office. You can submit that in writing, your proposals, your additional things to the draft resolution that you received, and it's part of your materials. Are there any ideas concerning this? Nothing. All right, let's support it. So let's vote so that we take the resolution as a basis. You read it. Beforehand, we decided to take into account experiences of other governments and states, and we will set a date. So who's in favor of adopting this resolution as a basis? We don't know. Nobody is against. So while you're here, and tomorrow we'll have an international conference, so throughout these 2 days, you can submit it in writing, or you can do it orally, and our group will document them. So this group works here as the Secretariat of the Eurasian Ombudsman Alliance that you elected, and we have a secretary, Ilya Valentin, which will provide instructions to the secretary because he's his subordinate, and the elaborated document and the final version of it. I will ask my colleagues. It should be submitted for approval to all alliance members, and before November 20th of this year. Any objections to this? Dear colleagues, I sincerely thank you all for your participation. We have heard 4 words of welcome from government authorities. We heard 12 most interesting presentations. Thank you so much, and wish you a great remainder of the day. My colleague proposes to discuss at this session where we will hold our next meeting of the Eurasian Ombudsman Alliance, and roughly we can define the dates as well. The dates and topics. So, dear colleagues, what kind of ideas do you have if you support this proposal? So any proposals from you? Moscow and proposed topics. So dear colleagues, if you do not object to this, we propose to hold our next meeting in Moscow. And because I will still be the chair next year of the Eurasian Ombudsman Alliance. Any objections? No objections. And next year, Moscow, so welcome. We're looking forward to seeing you here. And the second thing is about topics. So which topics should be discussed? On my part, I would like to name the most relevant, the most pressing ones, but maybe we should give some time for each one of you to think about it, and you can submit them to us separately, and we will do this before November the 20th. With our colleagues, we have a youth council, we have expert council in my office that includes 50 recognized scientists, professors, PhDs. We have young people who come up with give tips on topics of relevance. So digital protection of digital rights in modern world, or right for education in new realities, because many students study in other countries. So this is something to be discussed. This is a topic of interest. So give it a thought. Propose your topics. We can discuss them, and then we can come to agree on the most relevant topic, and they will be discussed at the next 9th meeting of the Eurasian Ombudsman Alliance. With our 10 member countries, we invite others to join. Other ombudsmen can participate. We also invite you as observers, as guests, to participate in our meetings. Thank you so much for your attention. Have a great remainder of the day, and we invite you to a tremendous, beautiful ballet later tonight. It's called Esmeralda at the Kremlin Palace. And before that, you will have dinner, so bon appetit.